All right, so we are recording. Let's see here. Michelle, do you know if Jennifer is going to be able to join us today?
I did not hear that she wouldn't.
Yeah, I didn't either. Let me out. See if she's going to be able to join us. If not, would you be able to lead us today?
Of course.
Scott, not a problem. Thank you for joining us as you're able to. I know we have a couple people that are going to have to jump early and some people are coming late. So whoever is going to be here is going to be great. We'll get it going. All right, so I will go ahead and share my screen if that's okay with everybody. We'll zoom in so we can see. Let's see here. Can everybody see that?
Yep.
Perfect. There's Jen. Good morning, Jen. How are you?
I'm good. How are you?
Doing well. Thanks for joining us today. So it is 10:04. We already, I went ahead and announced that we have started our recording. So Jen, we will pass it over to you to get us started.
All right, let's see. So if we want to go through and introduce our members, did you do that already?
No, we have not. We just started our recording, so.
Perfect. Jen Vasquez, I'm the board chair, representing the public health entity, something like that.
I'm Michelle Muthing. I'm the vice chair. I represent the public sector. I am a crisis clinician, a trainer, and a consultant in the world of crisis.
Thank you, Michelle. Who wants to go next?
Scott Simpson.
Go ahead, Scott.
Sorry, Gate. Scott Simpson, I'm a psychiatrist. I'm the director of the Division of Community, Population, and Public Mental Health at the University of Colorado, and I'm here as the board's University of Colorado Medical Campus representative.
Katie Donahue, board member representing the CDA.
Karen Rice, I'm board member representing, I think, psychiatry. I am, what's my new title? I am now part of a merged organization, no longer Mental Health Partners. We're Clinica Family Health and Wellness, and my new title is Executive Vice President of Psychiatry.
Congratulations. Thank you.
Yes, lots of changes.
Yeah, it seems like a very exciting changes, so congratulations. Anybody else?
Hal Mandler, I think I represent the law enforcement part of this, commander with the Littleton Police Department.
Thank you, Hal. Great seeing you today. Thanks for being here. Any other members?
So I think I'm technically a board member.
You
I
are.
get confused.
You are, Jessica.
So I'm Jessica Bell. I am the Associate Director for 2765 Services with BHA, and I represent BHA on the board. I don't know, something like that.
That's exactly it. Thank you, Jessica.
I knew I could count on you, Caitlin.
I'll jump in. Hi, everyone. Casey Wolfington. Sorry I was gone for a second. I had to find my earbuds, which are now dead, so it doesn't even matter that I successfully found them. And Caitlin, who do I represent? Am I providers or am I rural behavioral health? One of those?
I believe. 1 second, and I can let you know that.
Something. I represent something.
That you do. Give me 1 second and I can pull up exactly it. Let's see. Nonprofit healthcare facilities.
Well, there you go.
Thank you, Dr. Wolfington. All right. Anybody else? All right. Thank you so much, members. Jen, I'm going to pass it back over to you.
Hopefully everybody had a chance to review the minutes. Does anybody have any questions about our agenda, or not our minutes, I'm sorry, our agenda? Does anybody have questions about the items on the agenda or anything to add? Any public comments from our folks from the public? Okay, moving on to September's minutes approval.
So this is a very brief, quick review. Again, it is linked to the agenda, so you can review at your own time as well.
Everything looks good to me. I will motion to approve.
Anybody would like to make a motion to approve the September meeting minutes?
I'll motion to approve. Can you guys hear me?
I'll second.
Heard, seconded, yeah.
Okay. September's minutes approved. Can you guys hear me okay?
Yes.
All right, just making sure. Let's see. All right, so September's minutes approved. Last time we met, we spent a lot of time on our bylaws in the draft. Last 2 times, I guess I should say. So do we want to just pull those up really quick and take one last look before we finalize those?
Yeah. So for the second draft of bylaws, I've taken all of your comments and feedback from the first draft within all of those notes and incorporated it into the second draft. So here we have, I've put together a mission statement and a vision statement based off of the feedback that you all provided. So I want to kind of review that today and make sure that this language sounds agreeable to everybody. And then we can quickly go through and kind of look at where we've incorporated that feedback. And I still have like a couple of comments that I wanted to just kind of briefly review with you all today. And then depending on how this council feels, we can either go back to the drawing board and do a third draft and keep making revisions as we go along, or we can hold a formal vote today because I do believe we have reached quorum. Let's see here. Joy, can you correct me if I'm wrong on that?
Count 8 present.
So we're over 50%. So we've reached quorum. Just barely, but we made it. So great. All right. So can everybody see this pretty well? Do I need to zoom in a little bit more?
I think it looks good.
Thank you, Jen. Okay, so far we have the mission as the Mental Health Advisory Board brings together the respective observations and professional viewpoints of its diverse members to advise and make recommendations to the BHA Commissioner regarding the rules and regulation of involuntary care and treatment of persons with behavioral health disorders. Through public input, community guidance, and professional expertise, this council aims to assist in the development of a just, accessible, and equitable behavioral health system that protects individuals' rights and the behavioral well-being of all Coloradans. What do you all think about that? See a thumbs up from Michelle.
I like that.
Is there any language in here that, you know, is not clear, or we need to kind of redefine, or maybe even use a different language altogether?
I just have a question around like behavioral health disorders.
Mhm.
So coming from like the licensing perspective and that part of it, and I know we all know in practice like substance use and mental health go hand in hand, right? Like I'm not saying that that's not the case. Just the way 2765 is worded, it talks a lot about mental health disorders.
Mhm.
So do we want to stick closer to what statute says, or do we want to start looking at incorporating substance use?
Yeah, so when we are using behavioral health, that is very much an umbrella term. Let me pull up the exact definition that is defined in Title 27. So it includes, let me see here. Give me 1 second, y'all. Sorry about that. It includes both mental health, behavioral health, substance use. It's kind of that overarching term that the BHA uses. And so let me see here. Let me pull up this definition. So behavioral health is defined by statute as an individual's mental, emotional well-being and actions that affect individuals' overall wellness. Behavioral health issues and disorders include substance abuse disorders, mental health disorders, serious psychological stress, serious mental disturbance, and suicide, and range from unhealthy stress or subclinical conditions to diagnosable and treatable diseases. It also describes a service system that encompasses promotion of emotional health and prevention and treatment services for mental health disorders and substance abuse disorders. So when we're referring to behavioral health, that is like the exact definition, which we can include a footnote here to kind of link back to Title 27. So when people are looking at like how we're defining behavioral health, it automatically goes to that term. However, if you think that it makes more sense to stick specifically with, you know, just the mental health and substance use, that can also be an option. Ryan?
So Jess, I think what Jess is getting at is this mental health advisory board for service standards and rules is specific to or the provisions of mental health specific that doesn't include substance use disorder. I think that does not mean that we can't talk about how substance use and specifically involuntary substance use provisions fit into a larger scope, because people are a lot more complex than just substance use versus mental health. But the scope of this specific board is mental health specific. Jess, I'm assuming that's what you were getting at there.
Yeah, you said it much more eloquently than I did.
Yeah, so if it makes more sense just to focus on that, we absolutely can. Jennifer?
Oh, I was just going to add that specifically our board is called the Mental Health Advisory Board. So maybe it does make sense to just say mental health.
Sure. So you're changing behavioral health to mental health disorders?
Does anybody object to that? Okay.
Sounds good. Thank you for that. All right. So moving on to vision. So the vision of the Mental Health Advisory Board is to actively participate in the reformation and advancement of Colorado's behavioral health systems of involuntary care through public participation, cross-community collaboration, and meaningful recommendation. Again, we have behavioral health systems, but then we specify of involuntary care. Would it make more sense here to also talk about mental health specifically, or because we're trying to impact that larger behavioral health system through involuntary care specifically, does it make sense to keep the behavioral health system here?
I think consistency.
Yeah, I agree.
Okay.
Agreed.
All right. And what about the rest of the language for the vision? Is that Is that how you envision the act of this council, or do we need to change some additional language, add, subtract?
Do we want to say? It just kind of sounds weird. Mental health systems of involuntary care. Through involuntary.
Well, it's not only involuntary care. Right, 2765 also touches on voluntary.
Could you just take out that phrase? Just take out of involuntary care.
Yeah.
Mental health systems through public participation. Yeah. Yeah, that sounds better.
Sounds good. How do we feel so far? Are we good to move on? Some head nods. All right. Sounds good. So down here, again, we have our creation and duties. I'm actually going to pull up the first draft.
Hey, Barbara has a comment.
Yes. Here. Let's see here. Okay, so the vision speaks of the system, but not about the individuals within the system. Thank you for that. Should we mention something about here about individuals impacted by the system as well?
Yeah, I think it's a good observation, Barbara. I guess where I sort of land is I think we call out individuals and individual Coloradans in the mission statement. And I also feel like we don't like the work of the board is really focused on, regulations, rules, systems, and you can't have systems without individuals who are treating. So I guess I feel like I like a shorter vision statement and feel like we recognize individuals in the mission. So I would feel comfortable staying where we're at, but it's a thought-provoking comment.
Yeah, thank you for that. Yeah, I mean, I completely understand where Barbara's comments coming from, and agree that, we do talk about, the Coloradans and everything like that within the mission. What does everybody else think? What do you think?
I agree.
All right. Sounds good. Well, let's go ahead and move on. And then if the council feels like we need to come back and kind of review this a little bit more detail, we absolutely can. So our next comment, we have moved to, so creation and duties, that all stayed the same. There wasn't really any comments or questions about that. So it looks like our next comments were made down here under B, new council members. So it was specifically around the training, and just a comment was made about, the creation of a handbook that might explain the legislative and rulemaking process. We're definitely going to have, more conversations about rules and legislation today with Joy and Ryan, and that can definitely be something that we work to put together in the future. I'm also really excited to just announce for not even just new council members, but all council members. If you go to our BHA homepage here, under About Us, we now have a new boards and commissions landing page. And so this is going to encompass all of our four statutory councils here and different links to our different councils. So MHAB right here. We also have created some handbooks and guides and different links for resources for members to use. So for example, the boards and commissions member guide, this is just going to have some additional information about, what boards consist of, the different types of training, how to apply, how to resign, different things about different laws, such as the open meetings law, KORA, our code of ethics and things like that. So that is a new resource that we've worked to build out for you all that is now accessible via the BHA website. Again, this is not all encompassing, like, oh, we've done it, we want to continue to build out training and everything like that. So the more that you all utilize these resources, the more gaps that you find within these resources, please let us know, because we really want to work to build out training and resource guides and things like that that really support you all. So whenever you do have some free time, if you want to kind of go in and navigate these websites and look at the MHAB page specifically to see, what additional information we could add to our landing page, we're absolutely able and willing to do that. So we have some good training, but it's just the foundation we want to continue to build out. So just wanted to highlight that there. And then, so that was just a comment made about training. And then, let's see here, scrolling down. Let's see here. We automatically jump all the way down to our recruitment activities. And specifically during appointment. So, Michelle, we had added a couple of comments here. So we see now that during the main meeting, the council as a whole or designated subcommittee will review applications and select applicants based on the needs and statutory requirements of the council. In making recommendations to the commissioner, the council shall be dedicated to including persons of diverse populations and perspectives and shall attempt to assure racial, economic, gender, and geographic diversity. So that has been added in. And then here, so Michelle, you had actually made a comment on September 27 about striking all of this out. So the applicant referral package. So this is actually not going to be, oh, hey, Brittany.
Hi, sorry, I didn't mean to interrupt you. I just wanted to point out in the chat, we have a message from the other ASL interpreter who is asking to be spotlighted so that they can relieve our ASL interpreter who's currently.
Thank you.
Yeah.
All right. Let's see here. All right. They have been spotlighted. Thank you for calling that out, Brittany. All right, so for this applicant referral package, this is actually not really within our control of change. This has been designated by the governor's office, and this is how they receive applications and applicants from us made on our recommendations. And so this is mostly just for reference for new members and current members on basically how this process works and what these application packages consist of. So we can remove it, but it's basically just some additional information for you all. It's not really anything within our scope of change. So just wanted to kind of bring that up here to see if this is information that you don't find useful or to clarify, because I think we've mentioned it, yes, up here to complete the applicant referral package. And so it's more just for an awareness for anybody who's reviewing our bylaws that it's like, what is this application referral package? It's this. It's going to have all of this information in here that we go through and do checklists. And then we have our current board composition that we can show to the governor's office in comparison to our applicants that we're referring over. So they see, what demographics we have, what personal and professional backgrounds people are coming from and things like that. So just wanted to kind of point that out to see if this is something that you all would like to keep at this time. If you feel like this information is relevant within the bylaws, or if it's something that you would like to just have removed.
I don't think it hurts, that's for sure. But is it necessary is the question. I don't have a strong opinion one way or the other.
Yeah, it doesn't bother me, but if it wouldn't bother me if it was out either. I agree with you, Michelle.
do you think that since we're kind of one way or another, it would just make a little bit more sense just for clarification purposes to keep it in for now? And then if we, in a year or so, review the bylaws to make sure that there's no updates or changes that need to be made, we can go back and review if this information is pertinent.
That works.
That's fine.
Okay.
Keep us moving.
Sounds good. So I'll just go ahead and mark that off then. Let's see here. And then down here, wanting to, there's some comments made about the executive steering subcommittee instead of the council chair or vice chair consulting with members about the attendance. I just wanted to, ask the council as a whole, for that executive steering committee, who would actually be that point person in charge of sending out that email? Since there are, at least, I think it's like 4 to 5 members of the executive steering subcommittee, obviously everybody can be CC'd on that email, but wanted to actually clarify within this document who's going to be that exact point person who would send that email out, just so that there's no room for error or confusion on whose responsibility that actually is.
I thought the discussion was that we had it pigeonholed to one person. And the discussion was, but if that one person's not available, the bylaws really narrow it. So we opened it to the executive steering committee. And then we would discuss in our 3 or 4 person group, and the chair would say, I'll send it out, or the vice chair could say, I'll send it out, or the BHA representative could say, I send it out. I thought, and I could be wrong, but I thought we left it open like this and changed it to this because it was too narrow. Am I wrong?
Now that you say that, that seems, I feel like that is what we discussed.
Because if someone's gone, then it would
Right.
just fall to someone else. But I mean, it's only 3 or 4 people talking. So between those 4 people, they just decide who's going to do it based on Jen might be totally swamped and say, Michelle, I literally am not going to be able to get to this until midnight on Saturday. I've got so much going on. And I'll say, I got it,
Right.
Should we say a member of the council's executive steering subcommittee?
A designated member?
Yes,
Right,
there
like
you
let's
go.
say a member designated by the executive steering committee.
Or maybe you just say if a member fails to attend for 3 consecutive meetings, the council's executive steering committee will convene and a member will be designated too.
Okay.
I like that. What do y'all think?
Does that force the executive steering committee to have a separate meeting to discuss who to designate, rather than just saying the council's executive steering committee will designate? Just trying to make less work for people.
Yeah, I mean, convene honestly could be, we do a group email.
Okay, as long as it's that. I think we should be, if we're gonna do this, or if this is looking like it needs to happen, we'll probably meet about it anyway.
Yeah, that's a,
So yeah, I mean, as you convene to review that member's participation during that meeting, you can say whoever wants to volunteer, chair, vice chair, just a member of the committee can say, I'll send out the email and then CC everybody.
yeah. And even if, again, if people are so super busy, it's hard to get this. We meet once a month to prep for the agenda for the meeting. So we meet anyway. So it's not like it's an inconvenience to meet separately, I don't think.
Yeah.
Do you feel good about this moving on?
Mhm.
Okay. Sounds good. All right. Let me go back then, and then basically we just changed this from the chair and vice chair to the BHA boards and commissions coordinator. So, all right. Let's see what else we had. So down here, under meeting quorum, we changed some language around here. So instead of that the meeting would be adjourned and rescheduled, we have changed it to that the meeting shall proceed as scheduled, though the board will refrain from taking any formal voting actions. So basically, if we don't reach a quorum, we just can't vote on anything during that meeting.
Makes sense.
All right. And it looks like that is about it. So what do we think about where we are at with everything right now? Do we want to take a little bit more time and review the second draft individually, and then we can hold a formal vote at the next meeting in November? Or how do you all feel about this right now?
I feel pretty comfortable with it. I don't know if we need to spend more time.
I agree. We've put a lot of time. It feels
Right.
really good to me with the discussions we've had. This looks really nice, I think.
Yeah, I would agree. I mean, I don't want perfect to be the enemy of the good, and I think this will help us execute the mission. And so let's do some other work.
Sounds
Thank
good.
you for your guidance, Caitlin.
Of course, my pleasure. Thank you all for all of your work and your feedback. I mean, this is your bylaws. I've just kind of made the template of it. So thank you for working through that and all of your time and commitment to it. Because I mean, this is what makes your council your council. And so, all right. Well, here we have, if we want to go ahead and then take a vote, and then what I will do is send you an electronic e-bite, Jen and Michelle, to get your formal signatures on this. And then
Okay.
once we have those e-signatures in, I'll send out a official PDF copy to all of the members, and then we will upload this to our public facing website as well.
Beautiful.
This
All
is
right.
exciting. I've been on this board for a long time, and this feels like really we've done something very successful.
Oh, I'm
Yep.
so excited. You all have put a lot of hard work into this. So, all right. Well, Jen, I will pass it over to you to hold this formal vote then.
Does anybody want a motion to formally
I
adopt
will.
this?
I'll make a motion to formally pass the draft bylaws into formal. Is that what they call it? Formal?
Mhm.
Final. Final form.
I'll second that, Michelle.
Yay. Good job, everybody.
How exciting. All right, everybody. Well, we have done bylaws then.
And ahead of schedule.
Woo, we're cooking today. I was like, maybe we'll get out early, but I know Ryan really likes to talk about rules. So we'll see. We'll see what we do here. And so this is just a friendly reminder again about the MHAB Annual Report Subcommittee. So as we've talked about, the last couple of meetings, we are wanting to start creating a formal, annual report or letter of recommendation that we can submit to the BHA each year. And so this subcommittee will begin in January of next year, and kind of what we're planning on is holding it 1 hour for each month just to come together for those members who volunteer to be on this subcommittee to, work through really our list of running ideas that we have and get them into a digestible format with, that highlights, why we've made these recommendations, who it might impact, why we need these services and things like that. And so right now we only have 2 volunteers that have completed this application. So we're looking to get at least 5 council members to volunteer. Again, it's going to be an extra hour each month. So it is a little bit of an extra lift, but it's not anything that we're like wanting you to quit your day job and, completely dedicate all of your time and energy to, but it will be, a little bit of an extra lift. So just wanted to kind of point that out here. It is, the application is linked in the agenda. So if this is something that you have the time and bandwidth for, we could really use your support and your energy and your expertise in writing these annual reports / letters of recommendation, so we can really start tracking, the success of this council and how our recommendations and these amazing conversations that you have each meeting are actually impacting the behavioral health system within Colorado. So again, just a friendly reminder, if you have the time, if you have the bandwidth, please go ahead and apply. I'll start reaching out to members probably like November, December to start scheduling times again for 1 hour each month beginning in January. And if you have any comments, questions, or concerns, please don't hesitate to reach out. We'll try. We would like you to attend every meeting if you can, similar to, these council meetings. But if something comes up, you're not able to make it, it's not the end of the world. Just all we ask is for communication and then, just review some of the information that we might have worked on during that council meeting or the subcommittee meeting that you've missed. So you can just kind of catch up and continue with conversations when you're able to return and participate again. All right. Well, with that, we are 6 minutes ahead schedule, and I'm going to pass it over to Jessica.
I don't know if I have any new rule revision updates. We kind of talked a little bit last time of some of the things that are going to be changing for Chapter 11, which is our 2765 chapter. We talked a little bit last time about eating disorders and setting up a work group for that. And so I am still like in the initial phases of what we want that to look like, and reaching out to some of our partners. So I don't have any big updates, but eating disorder rules will be part of some of those rule revisions next year. So if anybody has any
Jessica,
questions.
can you provide a little background on why there's a focus on eating disorders and where this is coming from?
For sure. We had a Senate bill passed, Senate Bill 24-117, in this last legislative session, and it deals specifically with eating disorders at several levels of care. So we've got eating disorder rules that we need to build as BHA for residential or inpatient. We have to do it for partial hospitalization and intensive outpatient levels of care. One of the call outs is also creating a Bill of Rights for eating disorder patients and to speak to restraint for involuntary feeding tubes. So this section of statute that was created out of Senate Bill 24-117 is actually 2765.5. And the reason for that is because lots of the court processes for the involuntary feeding tubes goes through the 2765 statute processes right now. So we have a couple of eating disorder providers, Denver Health Acute, and we have Eating Recovery Center right now that are already designated. That bill will require other eating disorder providers to become designated. So we've got a lot of work ahead of us as far as what we're going to be doing. And so that's why I say we'll have an eating disorder work group coming up to help build some of those rules.
Are there any other organizations in Colorado that are doing this besides ERC?
There are. We are still in the process of compiling our full list. The ones that I have identified so far are mostly IOP or PHP providers. I know Children's has a day treatment eating disorder program. However, day treatment's not called out in the bill. So I've got some other conversations that are happening with that. But those are going to be our big ones, is Denver Health and ERC.
Are those,
And I would,
are those identified facilities going to be the only facilities that are able to enforce the court-ordered feeding tubes?
What do you mean?
So if part of this work group and the bill revision is going to include rules and regulations around involuntary feeding tubes, are those specified facilities going to be the only ones that can forcibly do those?
No, so there's still always going to be the ability to do it within a general hospital. Like this is specific to any provider that is providing eating disorder treatment and recovery. And so where we draw that line between what is treating an eating disorder and involuntary feeding tubes, maybe for somebody who is like deathly ill and unconscious, like there's some nuance there. And I don't know if I'm totally hitting on what you're getting at, Jen.
Just because we here have had to sort of forcibly feed a patient because of their psychiatric illness, are extremely paranoid with food and got to a dangerously low weight. And so we had to use 2765 court order medications to include involuntary feeding. So I guess I was just curious. It's not necessarily, I mean, he has sort of a background of an eating disorder, but this is more revolving around psychosis.
Yeah, it's not.
Oh, sorry. I would just add that as being the former city attorney who handled these cases, I know there's cases in Pueblo and might have been at Fort Logan where someone's psychosis is so bad that they won't take their medications, and certain medications only come in oral form, and it was required to be given through a feeding tube. So if there was a special designation just for, I think it would have to be very clear that it's eating disorders and not mental illness as a whole. And I just wish they codified ECT and feeding tubes anyway, but whatever.
Right.
I mean, the way that I kind of have it in my brain right now, and like I said, like I have lots of questions and bills, and I know like Ryan and I and a few other people internally for BHA have a meeting coming up the first week of November to kind of cut out some of those questions that I have lingering. But what I will say, so the designation that's going to be for eating disorders, it will still be a 2765 designation. What I'm hoping to have happen is in our ladders build, which is our licensing system for those that are not familiar with ladders, is it on your certificate that you would have to post your license that shows you're designated, it would mention that you serve specifically eating disorders. The bill does not specify that only eating disorder recovery can have involuntary feeding tubes. If you have a court order because of someone's psychosis, like that's what we would look for. And what I'm hoping to build is some alternatives, what I would say, rules and regulations around like restraint for putting in a feeding tube. Because we have a lot of rules for physical management, restraint, mechanical restraints for behavioral or psychotic instances, right? And so we don't necessarily need that same high level of regulation for just restraining. I say just, you know what I mean, for the restraint to insert a feeding tube.
Got it. I would just recommend, like, when putting together the work group, to have respondent counsel and like someone on the city attorney side or county attorney side, just because they have to deal with it every day.
For sure. And one thing I will say is the whole eating disorder build around rules is an extensive process. So we will have like this initial work group to kind of help build out the first draft of rule and what we want this to look like for Colorado. There's still the stakeholder processing that needs to happen. And during that stakeholder process, there will be additional revisions to rule. We definitely want to get people with lived experience. And that's really where this bill came from, was people with lived experience talking about some of their for lack of a better word, they're really awful experiences going through eating disorder treatment and having to be restrained for a feeding tube and things that happened and how they were treated. So we really want to make sure we're not only offering like best clinical and best medical practice and regulation around it. We want to make sure that those that are going to be directly impacted have a say in how this looks. So this will be like all of next year is what I will say, because the statute, or not, it is a statute, sorry. that came from that Senate bill says anybody that's offering eating disorder treatment and recovery must be designated by January 1st of 26. So all of this will be a big lift in the next year. I know Scott had to jump up, but we will definitely review these rules in our meeting. Be part of the stakeholder process. Ryan, is there anything that you want to add to that process or what that would look like?
Thanks, Jess. I just want to reiterate that again, is that so the date in the statutory language in that 2765.5101, it is that no later than January 1 of 2026, BHA shall require all eating disorder treatment and recovery facilities to hold the appropriate designation. So that means the rules have to be in place, ideally, at least a few months in advance of that January 1, 2026. So that's the piece where Jess is talking about what is the initial draft of the outline of what a new chapter of rule would look like related to this type of designation, and then going through that full formal stakeholdering process that then creates what is the final version of a draft that then gets submitted through the Secretary of State's office into State Board of Human Services. This is one of those rules that are specifically called out going to the State Board of Human Services to promulgate. So there's still that full opportunity with the first reading and the adoption hearing at State Board of Human Services. But we want to make sure that this group is there early in this process about what that outline looks like, and who should be involved in those initial drafting and whatnot, as to make sure that this isn't just hey, let's bring this to the Mental Health Advisory Board kind of as an afterthought, but want to be more thoughtful on how we get stuff to this group early.
And something to keep in mind when we get to that point is Chapter 11, as it sits right now, is still going to be the base for those eating disorder and recovery programs. The eating disorder section that I'm starting to build in Chapter 11, along with some of my team members, will be that above and beyond, or what is different from what's already listed in Chapter 11, since there is going to be quite a bit of overlap.
Group, if I may switch gears a little bit related to rules, just like Caitlin said, I like to talk about rules. Could I kind of commandeer a little bit and talk about BHA's rule volumes and our stakeholder extension plan, as well as a pretty targeted request for feedback on a certain table, if I may add kind of a sub bullet to that rule revisions with Jessica Bell agenda item.
We have extra time anyway.
All right, Caitlin, can I share my screen, please?
Absolutely. Give me 1 second. Let me make you co-host. Right. You are co-host and I am stopping to sharing.
All right, BHA has 3 rule volumes, right? Provider rules, which I think the most people are probably the most familiar with, as that is the hundreds of pages of what it sets the licensing designation and approval standards for facilities specifically. This is the one where Jess was talking about. Chapter 11 is the 2765 chapter. There's also system rules. That rule volume currently exists. It's the 2 CCR 502-5. This is where BHA is currently in the process of rule promulgation to set and share the vision that BHA has for the behavioral health system. We'll dive into that a little bit further. And then there's the administrative rules. This rule volume currently exists as 2 CCR 502-6, that it essentially establishes how certain programs and initiatives are applied for or accessed. The current chapter within that rule volume just addresses how the form and manner to apply to become a behavioral health administrative service organization. And this is the rule volume where, if you're familiar with the bill, House Bill 1038 from 2024 about the kids system of care and high intensity services for kids, BHA has a rule promulgation requirement from that bill, and it's going into that rule volume. So those are a super high level overview of what BHA's 3 rule volumes are. I just wanted to set the stage for this board as there's a specific call out to this board of submitting recommendations about rules related to 2765. That does not mean just 2765 rules and how they pertain to that provider rule volume, which I think has historically been the, oh no, all things related to 2765 rules are in 2 CCR 502-1, the provider rules. That does not have to be the case. So I just want to set the stage that there's further opportunity within this board to drive the, what does the system as a whole look like in relation to all of the provisions underneath 2765 or 2765, the care and treatment of persons with mental health disorders that this board is responsible for. So with that, all 3 of these rule volumes are currently going through a revision. So we are going through engagement opportunities. We've been in person in 5 locations, and we've done 4 virtual meetings. You're seeing the expanded locations before the press release comes out. That's likely coming out today or early next week about going to Steamboat, Summit County, Leadville, Lamar, and Pueblo for in-person events over these next roughly 30 days, and then another virtual meeting on November 7th. You'll also see the times related to these, as we have been receiving very targeted feedback saying, hey, having these in the middle of the day is just not cutting it for folks to be able to participate in events like this. So hopefully we get some expanded opportunities for folks with evening sessions. So this press release will be coming out in the next few days here, as well as the laws and rules page getting updated with the opportunities to participate both in person and another virtual event. This next page, and this is the last slide, a lot of information on this, but this is what I'm talking about related to, this is a table that going through a version 2 of the system rules is hey, we have 14 safety net services that the BHA is required to establish what services are available on a community, regional, and statewide level. So this is a table that my team has thrown together to be like, hey, if we have geographic types, large metro, micro, rural, and counties with extreme access considerations, that's the 2 tables on the right side. If you're interested in what county designation your county is, this was created by the Division of Insurance when establishing networks for insurance plans. In Colorado, they have this same 5 geographic designation types. So this is my team just putting in distance in miles for each one of the 14 safety net services. You may be counting those up. It's actually 16 on there because emergency and crisis behavioral health services is listed as one behavioral health safety net service, and we've broken that down into the walk-in crisis services as well as mobile crisis and crisis respite to get to the 16 instead of 14 safety net services. The one specific question that I have for this group is, should there be a specific lines related to miles access to 2765 designated services within a list like this?
Can you rephrase that question, please, Ryan? Say it again.
Should there be a specific call out to miles to 2765 designated services as part of this list?
How would that be done? Would it be like, I guess I don't understand how that would be written, miles from city to city, like it is 40 miles from Glenwood to Aspen, it is 260 miles from Grand Junction to Denver. Is that what you're talking about?
Yeah, so if we come up with designated service or individuals receiving services underneath a certification, for instance, either happen within a inpatient residential or an outpatient setting. Should we specifically call out 2765 designated facility or designation services happening in an outpatient setting, the access or mileage access to those types of services have a specific mileage? We could also do the same for 2765 designated inpatient services and have access considerations there. Because it feels like we oftentimes miss, and this is the very targeted feedback that we got from the first round of stakeholdering these rules, is that, hey, BHA, you completely miss the high acuity and involuntary service delivery as part of the system.
Yep.
So kind of asking that as, is this something that the BHA should pursue?
I personally, being in a rural community, think that would be amazing to call out, because I think when folks are sitting at a table addressing an issue and talking about a topic, sometimes the distance and location in certain areas gets forgotten. And I think if that is called out, it will always be in the front of someone's mind, and they can say, oh, well, wait, hold on, let's look at this mileage calculator too. I personally think that would be a wonderful addition.
And I completely agree with you, Michelle. And Ryan, you're probably not surprised to hear me say this. I think it would be fabulous. I think it's often missed, like Michelle said. And I don't want to make your table like overly cumbersome and messy, but I think something else that mileage sometimes misses is geographic barriers. And I wonder if there's a way to demonstrate also that, you know, this involves a canyon, or this involves a mountain pass, or
Yes.
lack of paved roads, or X, Y, and Z. There's just so many things that 30 miles can be like, oh, I can just buzz there, when you're like, well, no, it's actually a canyon that closes pretty frequently. And I just wonder if there's a way to show that. I don't know that way, but somebody.
And that 30 miles might be 30 miles in the summer, but the pass you're going over closes for 6 months out of the year, and it is now 180 miles.
So maybe it's actually even, Ryan, just an acknowledgement of this mileage, and maybe there's an asterisk that says this mileage has notable geographic barriers.
Yeah.
Or something like that.
I can get to Gunnison in 2 hours to go over the pass, and in the winter it's closed. And that same 2-hour drive takes me 5 hours in the winter.
Yep, and I think part of this also comes with these numbers that are currently listed in these boxes are me and my team putting in numbers based off of what Division of Insurance has for what I was assuming similar types of services for their healthcare. So all of these numbers are subject to complete change as well, but I love the call out with hey, there has to be some ability to address what does it actually mean with miles and distance standards, because the geography in Colorado is quite complex.
As the crow flies, we can get anywhere we want, but that's not how we drive.
Yeah, looking at a map is very different than actually being out there. So
Right.
Megan, you have your hand up.
Yes, and this is Megan Exrad with the Colorado Hospital Association, and I am a member of the public. I am not a member of this wonderful board, and so obviously feel free to either disregard these comments or happy to come back later. But wanted to flag one, just thank you for this incredibly important discussion. CMS does consider this for kind of critical access hospital designation. So to the extent that there are federal models out there that could be helpful, just wanted to flag them. So it's in CMS, it is a 35-mile rule from the nearest hospital or critical access hospital to be designated, or more than 15 miles in areas with mountainous terrain or only secondary roads. It is not perfect, but it is a standard for kind of defining some of these things, and a little bit of a precedence to the extent that's helpful.
I love not reinventing the wheel, Ryan.
I agree. This is exactly what I was looking for with feedback. So thank you. I'm good with Frank going, also a member of the public, but for that too.
Same intro, member of the public. I appreciate Megan's call out there of existing resources. I'd be curious whether in that resource or in your thinking, Ryan, about the access to these safety net services, if there's any sort of weight or account for what already exists in terms of infrastructure, like how to sort of account for what already exists, so that we're not artificially sort of cutting off natural access points, just based on not arbitrary number for mileage, but that being one data point. So
Yep, I appreciate that.
Go ahead.
No, I really appreciate that. I think that's really the opportunity that we're looking for at BHA, is to really establish what do the people across Colorado deserve. That exists in a lot of spots. There's also, we hear quite a bit of, hey, I just don't have access to things in my community or even in my region. So how do we start to address the what is, and how do we at BHA have all of that written down related to what our system, what is our continuum? So I think that is part of what we're trying to establish here. So then when we have those really detailed conversations, but I just don't have access to residential services in this whole part of the state, like what are we actually looking to do? So then that's where we as a whole state can start talking about what are those barriers to what doesn't exist. I think this is part of what BHA was originally called to do, is establish what this process is. And so this is one of those, what I mean, being very, very frank here, is hey, a thing that maybe should have happened earlier within the existence of the Behavioral Health Administration, and setting this up as a way to speak about what the experiences that people see and have through the last 5 years or more of task force participation. So I'm trying to get to that. The thing with system rules, it's not specific to calling out a specific entity, organization, provider type. It is the BHA saying, this is what we are planning to do within the behavioral health system. Part of that comes with, these are not State Board of Human Services adopted rules. These are commissioner adopted rules. So it's the commissioner saying, this is what I'm doing as part of the vision for behavioral health in Colorado. So a little bit different construct as well related to the rule volume. But
yeah, that makes sense. And I would assume one way you're going to hold bosses accountable for their, the requirements by region, right? So I think that's helpful, hearing you describe it that way, that it's, this is about sort of identifying those gaps. How can we sort of, as the system sort of recalibrates, how do you fill those gaps, but also keeping in mind, I think trying to minimize, disruption as much as possible, and yeah, to build and fill versus, disrupt and
Rebuild.
yeah, rebuild, exactly. Yep.
so want to continue to have opportunities within this board, within whether it's BPAC, BHAC, the Children and Youth Standards and Regulations Committee, having opportunities to have these types of opportunities for feedback directly to me, as well as my team is always available to everyone, board members and guests. So please reach out to me about ways to kind of redraft, improve, explain better. My goal for the version 2 of the system rules, version 1 is currently on our laws and rules page. I want the version 2 to be out the first week of November, as in preparation for that first virtual meeting of our second round of stakeholder engagement, that November 7th date. So as soon as those are available, I'll make sure that folks on this call are aware of where to find the new version 2 of system rules proposal as well, which likely will contain a table very similar to this, but maybe with some modified numbers and hopefully some explanations that come along with it as well. So thank you for the opportunity to present there for a second.
Thanks, Ryan. That didn't take nearly as long as we had planned. And just for everybody's awareness, I did put my email, Ryan's email, and Andrea's email in the chat for you all. So if you have any other additional questions, comments, or concerns about this presentation, please don't hesitate to reach out to one of us, all of us. We're definitely here for you all. Thank you. All right, any comments, questions, or concerns for Ryan? Or Jen? Or not Jen, sorry. Jessica. I was about to say Joy, and then Jen, and then Jessica. It's Friday, you know.
It's just one of those J names. It's fine.
All right, everybody. I'll go ahead and share my screen again, and then we can kind of look at our running list. Let me get that back up. Give me 1 second, everybody. All right. So looking at our agenda, we have the running list and additional board recommendations. So coming back to our meeting minutes, this is where we have our running list. Zoom in on this. Is there anything else that we should add at this time or talk about in a little bit more detail? Again, this is, some of the amazing conversations that you all have had, and really starting to kind of use these as we start thinking about, our annual report / letter of recommendation, however we want to actually formalize that. These are some great conversation pieces that you all have had and some ideas that you have brought up, and we can really use these to start guiding our work and creating those formal recommendations for the BHA. So if there's anything here that we should kind of expand upon today, we can. If there's any information that we should be adding, we absolutely can.
Pretty hefty list.
It is. It's going to be a good letter of recommendation for sure. And even if we don't get through all of them on the first one, we can keep working through them. So
Just for clarification, are we, when we get the official subcommittee, are they gonna be drafting those notes, and is it gonna be one, I guess, letter for each bullet point?
So what my kind of plan is I'll be, you as like the BHA administrative point person. So what I've done for some of the other councils is for their recommendations, we've gone in and discussed their recommendations in detail, made some additional notes, and then I put it into kind of that digestible format similar to what I've done with like the bylaws for the creation of like the mission vision statement. It's all your words and recommendations. I just kind of made it into those paragraph forms. So we'll plan to submit, one report or one letter of recommendation and use these bullet points kind of like as our subject matter, and then we'll break those down into further detail. So it will be like a larger report or a larger letter of recommendation, however you all want to, whatever format you all choose for that. But so right now, let's see, we have 3, 4, 5, 6, 7, 8. So basically what we could do is take one line a month that we have right now. So let's say in January, we really focus on the automation of M1 and break down into detail, what that recommendation is, how you all came up with that recommendation, why it's important, and things like that. And then in February, we can start building that out and kind of going through each item individually. And again, I'm happy to put that into that digestible format unless somebody else within the subcommittee would like to. Just don't want to, overload you with work and things like that. So I'm happy to be that kind of point person, note taker in that realm. But that's kind of what I have envisioned, and similar to what we've done with some of the other councils. Now, if there is a whole different process that you would like to utilize and do it in an entirely different way, totally up to you all. However you all see fit, and it makes the most sense for you all to get these into that digestible format so we can make these formal recommendations.
Can I ask, for the newer members who weren't around when these recommendations were made, can we spend one of these meetings going over what the recommendations and the reasoning behind it are?
Yeah, I think that's a great idea. What does the rest of the council think?
Yeah, for sure. I also, like, I love how ambitious we are. I just don't know how feasible it would be to submit all 8 of these pretty hefty lifts. Like, I guess I just want clarification on what this process looks like after we make the recommendation. I just feel like all of these are big things, and if we submit all 8, it might be a very long recommendation letter wherever that goes. So do we want to like maybe split it up, or?
I would agree with that.
Well, we could, when we go, if we go, you know, we, as Katie was recommending, review them, maybe then prioritize. We could just pick some. I mean, we're running up very close now to the legislative session. I don't know if any of this stuff, if we could even get it together in time for any legislative recommendations.
Realistically, probably not this year.
That's what I was thinking, but I just wanted to throw it out there. Okay.
So BHA, they submit their annual report to legislation, correct me if I'm wrong, Ryan, but October 1st, correct?
Well, so a couple different things, if I may. So I think there's an opportunity. What we've done previously within the Mental Health Advisory Board was separate out the recommendations from what are statutory changes, what are regulatory changes, what are just process changes for BHA. Like, for instance, the training on pickup orders, like that wouldn't be a regulatory or a statutory change. That could be a thing that the BHA just implements. So I think there's an opportunity with even some of these. I love the idea of, hey, there's some new members, so can we maybe have a breakdown of what these look like and have upcoming meetings address some of these things. Part of that is the timing of we'll call them agenda bills coming from, say, the Behavioral Health Administration. That process starts incredibly early, like in April, to get that process started so it would be April of 2025 is when we start establishing what agenda items for bills in the 2026 session would be. Other councils like BHAC have a specific report that is due to BHA about recommendations on the system that is due in September, that goes into a BHA annual report that's due October 1. So there are different timelines associated with when recommendations, if there is an annual recommendation packet coming from the Mental Health Advisory Board to BHA. I mean, I think that's an opportunity for the board to discuss what would be the best timing for that. Some recommendations, if they're recommendations for statutory changes, there's probably need more advance notice than what could come at any time related to just process changes within BHA, which we can implement those pretty much.
I like the idea of prioritizing. Oh, sorry, Ryan, didn't mean to cut you off.
Go ahead.
I really like the idea of prioritizing because two things are hitting me as I'm looking at this list. Number one, you had asked folks to sign up to be on that subcommittee, Caitlin. But to be quite honest, to write these letters, I think there needs to be specific people at the table, because I believe the way we discuss this, the report and recommendations are not just, hey, we really think you should automate the M1. Good luck at that. Let us know how it goes and if you need our help. Like, we want to make it a substance. We want it full of substance, right? We want to be able to say, here's the reasoning behind this. Here's whatever. And here are some thoughts we have in moving forward on how this might. So I think you need, for some of these, you do need some of the right people at the table. But aside from that, I like the idea of prioritizing because just like Ryan was saying, some of these have statutory or legislative implications that are not going to happen quickly, and some can happen a little quicker. And so I would love to be able to pick one, at least one thing that we know could make impact and move quickly, and maybe one thing that is going to take that time, but just to be able to feel like we've made a change or a shift in something we've done. Being able to prioritize what we do this first round, I think is really a great idea.
I do as well. And right. And so that way it's not going to be, I mean, one of the other councils, their report, I think, is about 13 pages, and we can do a 13-page, but if that doesn't make sense for this council, then it doesn't make sense. And we can really prioritize, what we want included in this first round of recommendations. And similar to what you all said, maybe one or two that we can implement quickly within our agency, and then maybe 1 to 2 that's going to take a little bit of time through state legislation, and really, being intentional about our recommendations and not just making recommendations as to why, but also as to how, and you all being in the field and being both personal and professional and experiences, that's how these system changes happen, and in a way that is actually conducive to the people who do this every day. So I think that that's a wonderful idea, and if it's agreeable with the council, I don't think that we have anything really pressing for the November meeting, and since that we might use that kind of as the end of the year meeting, we'll talk about that in a little bit with the council as a whole to see if you all want to have a December meeting. But if we decide not to, we can use that November meeting to go over all of these running list ideas in a little bit of detail, and then make that prioritization list. So when we reconvene in January, we can, be really intentional with our conversations that we're having during the next year's meeting, as well as preparing for that annual report / letter recommendation. So if that's agreeable with you all, I think we could probably use that November meeting to get some good detail about this and to start kind of building out what we have for the next year.
I think that makes sense, especially because it will be, if we decide, it will be a longer meeting.
Yep, agree.
That's good. All right. Well, with that, we're a little bit ahead schedule, so we have time for some questions. If anybody has questions about what's going on and kind of our plan for the future and what our plan for the meeting is going to be next time.
Caitlin, may I ask a clarifying question? Did I hear you say that somewhere way back an hour and a half ago, did I hear you say one of the things you want to put in the packet or that you want to have available is the legislative process and how representatives propose things, the bill goes to the floor, is that what, did I hear you correctly?
Yeah, so during the first draft of bylaws, a comment was made with regard to training. Let me pull up that document so I'm not speaking out of.
Yep.
Okay. Somebody had made the comment around training to create a handbook that explains the legislative process and rulemaking process.
Yep.
And so Ryan, correct me if I'm wrong, I don't believe we have anything like that right now, but that's something that, we at BHA can absolutely work on and towards, because I think it, not even just for this council, I think that clarification on rulemaking and legislative process would be helpful for everybody.
So again, not to reinvent the wheel, but the Colorado Provider Association, COPA, has a has that. So if we want to use that kind of as a foundation to see if it's something we could use, then you've got two groups really explaining things in the same way that's understandable and digestible. But just again, to that whole point of not reinventing the wheel, if we want to look at what they have, they do have that. It exists.
Absolutely. If you could forward me that, Michelle, that would be fantastic because I hate reinventing wheels when there's no need to.
You betcha.
Yep, and we have some of that information too related to even just like what does it mean when a bill is introduced? What does reading a bill look like? What is a bill becomes an act that then becomes a law, which then is codified in statute. So we have some of that stuff as well that we can. I don't want to put Frank Cornelia on the spot, but I feel like we used to do this in maybe even a joint fashion for BPAC way back in the day. But
yes, way back in the day we did.
Okay, perfect. That's great. Yes. Any information that you have regarding this, please send my way. I know especially on like the legislative website, there are some I know that there's like a training video, like a tutorial on legislative process and things like that, but I don't think unless we do somewhere that we have like that defined handbook with everything, but we can absolutely consolidate all these resources into one if we don't have one already. And then utilize COPA and everybody else's as well. But yes, and again, as you guys go through, some of the training slide decks, especially the new members, and start looking at the BHA website and the MHAB website specifically, if there's additional information, especially around like training or different legislative processes or rulemaking processes or really anything that you all run into that you really can't find the information on, but you think would be pertinent to this council, new members, and just members of the public in general, please reach out and let me know because we're always wanting to continue to build out our training and continue to support council members in any capacity that we can. And so we really want to be here for you all and be that resource and supportive tool for you all in the best way that we can. So again, if anything comes up that you're not able to find, you have questions about, you want some clarification around, please don't hesitate to reach out and let me know.
Amazing. Thank you.
Of course. Any other questions or comments for the good of the group? All right. Well, I'm going to pass it back over to you, Jen, to kind of plan out the next meetings and what we want to do about December and possibly getting a time on the calendar for an in-person meeting and hybrid option for next year, since we're so close to next year already.
Yeah. Okay. So first, historically for those new members, we have, because the fourth Friday of the month usually lands around Thanksgiving and Christmas. In the past, we have just combined the November and December meeting, either maybe mid-November or early December. So with that, I would make a formal motion to combine the November and December meetings.
And so the November meeting is on Friday, the 22nd. So that's the week before Thanksgiving. So
we did discuss.
So we're not falling on Thanksgiving this year, but then December would be the Friday after Christmas. And so that a lot of people, normally have some holiday plans around that time. So November again, is the week before Thanksgiving, that 22nd.
I second that motion to combine them, Jen, to close your motion that's on the floor.
Okay. Is anybody
Now let's work with the date.
does anybody object and really want two separate meetings in November and December? Okay. So then we can open it up for discussion. Do we want to just hold the meeting as planned on November 22nd and just skip a December meeting and then reconvene at the end of January?
I think that sounds like a plan.
And just for clarification, are we going to have the November meeting be from 10 to noon since we're no longer having a December meeting, or are we just holding it till 11:30 again?
I would suggest it's the 2 hours if we're going to go through all 8 of those bullet points.
I think
Agreed.
That's a lot.
It is.
We can do a 10
There's a
minute
lot
break
of
in the
information
middle.
there.
Yeah. I mean, just 2 of those could literally take 4 hours.
Yeah. So yeah, definitely we'll start with that prioritization list so we can get that up and running. All right, everybody, sounds great.
Okay, so just to reiterate, no December 24 meeting, and November 22nd, we will meet for 2 hours instead of the hour and a half. Okay,
Sounds good.
and
So,
then
just Jen, just so you know, we all have calendar invites for December. Can someone just cancel those so that everyone has that who might not be on this meeting, has that formally as a canceled meeting for December 27th? And then we'll keep it on November 22nd.
I don't know who did that, but whoever did that, I'm assuming Ryan. Thank you. Oh no, that's amazing. I don't know who did it, but thank you, everybody.
Beautiful.
all right, so then when was our last in-person meeting? August. So it's time to again decide if we want to do another in-person meeting, either maybe in February or March. And last meeting, or maybe it was our executive committee meeting, there was a possible recommendation that we hold it at the BHA office, which is that at the Sherman building? No.
It's at the CDPHE campus, so like on Cherry Creek and Colorado Boulevard in Glendale,
Okay.
and it's free parking.
Nice.
Oh, yes.
Quite
Sold
helpful.
right there.
Great.
I know it's gonna be that time of year where snow is always possible. So does anybody have a preference of February or March? So it looks
March
like
is always better.
February 28th and March 28th. Michelle, you were saying March would be better?
March is just a little bit more up in the, March is just a little bit more of a probability that weather will be a little less, not guaranteed, but a little. February is usually just solid snow. It just gives us a little bit less of a probability that you'll have people drop out at the last minute. Really no big deal. You can do either February or March. It's just Casey and I are going to come down the mountain.
Yeah. I definitely think March makes sense if that's agreeable for everybody. And then what I can do, the week leading up to it is just really keep an eye on the forecast. And if for some reason we have a freak blizzard coming through, I'll, just send out an email and saying, well, we'll try this again in April, so we'll definitely just keep in contact throughout those next several months, just to, keep an eye on the weather and the radar and make sure that everybody is safe and available to come.
You betcha. I think more than anything, this conversation came up because people had wanted to come up into the mountains, and I would hate to have a meeting space reserved for 13 people and then only 2 end up coming. So I think going to Denver is going to pose less of an issue. I think that's where this all started.
We should get definitely a lot less snow than you out there.
Shh, shh. Don't jinx it.
Knock on wood. Not gonna say that. We're gonna get 5 feet. Like
right?
Is everybody in agreement that we can hold it at the BHA office?
Sounds amazing.
Good to everybody?
Yeah.
And then Caitlin, Ryan, you guys will set that up and reserve a space. Perfect.
Absolutely.
And that was February, did you say, Caitlin? Or April? March. March. Okay.
March, yes. All right. Yay. Great, everybody. Thank you so much for all your help today. I will, Jen, if you want to close us out.
Yep, right on time. Anybody have any last minute questions, concerns? All right, happy Friday. Have a good weekend, everybody.
Thanks, everybody. We'll talk to you soon.
Have a great
Bye.
weekend.
Thank you. Bye-bye.
Bye.